It is indeed an honor for us to be with you today to celebrate this wonderful, wonderful grand opening of the Diabetes Health and Wellness Institute. Today is really about community. It's about partnerships that make communities stronger and make communities healthier. Today is about vision. It's about innovation. It's about quality. And it's about the future of how health care should be delivered in the future. It's about improving the health of a community and the quality of life of a community. Today is a very special day, and it is so appropriate that we are at the Juanita J. Recreation Center to celebrate, because Miss Kraft was about doing the right thing. She was about being bold and challenging the status quo to make life better for all people. She was a towering, historic figure that had a tremendous impact on the city of Dallas. She was recognized, and she has been honored by being the first in many ways. The first African-American woman to vote in Dallas, and the first African-American woman to serve on the Dallas City Council. And today is about first also. We are so proud to be with you today to open what is the first, and we hope not the last, of a new and an innovative model of care that addresses a huge community health care need and the devastating chronic disease, diabetes. And this new Diabetes Health and Wellness Institute is a center of excellence focused on the prevention, diagnosis, and treatment of diabetes. This center of excellence will attack diabetes on several fronts: through education, health care, exercise programs, recreational programs, and research. And we are gathered here today to celebrate this occasion because one individual had a vision, and that vision was big, and that vision was bold. We are here because this individual cared about a community he knew quite well, and he did not forget. And even though he has achieved great success in his own right, and has been well recognized for his success and for his service and his leadership, he never forgot where he came from, and he was determined to reach back and bring others with him. He is about serving others, and his persistence, perseverance, and bold vision, and as he would say, disturbed the equilibrium of the Baylor Health Care System Board. And the result was a commitment by the Baylor Health Care System Board of Trustees of $15 million to create what you see today. That person is Mr. Albert Black, Chair-elect of the Baylor Health Care System Board. Thank you, Albert.
Discussions in Washington on health care. The reality of it is we can all do more by simply making our community healthier. And that's what this project, that's what this center is all about. In a very non-traditional way, as Joel said, but one that we hope will all of a sudden become the model across the nation. Bring together all the elements so that we focus not only on diagnosis and treatment, but we also work on preventing it, getting people healthier, so all of a sudden we see that incidence rate turn back down. 250,000 Americans will die from diabetes this year. And I can tell you, walking through this community, walking through communities all across the nation, you understand how important a health issue as diabetes is. You walk through and you see the loss of a limb, you see the loss of eyesight, you see the loss of a kidney, and then you see a loss of a life. That's really what we're talking about today.